try to make a lot of resources available for you as well today, and make time and also have information on my handouts about how you can contact me afterwards. So we start off, let me have a disclaimer, let me share with you at least what I find helpful when I talk with people about alcohol and other drug use. I am not here to preach. I am not here to talk about anybody's drinking patterns. You will not be quizzed. This is an important matter, but our culture is very accepting of mood-altering substances, if you will, alcohol being the primary one. So some people will hear this and may get questioning or uncomfortable at times, but I am not here to preach, and I am not here to advocate abstinence or teetotaling. I do want to share with you what we've learned, what we're continuing to learn when we have pediatric trauma patients with positive alcohol and or other drug screens. What do we do? That seems to be a question for many of us, whether it's in the field, in the school counseling office, in the hospital bed. What do we do? Now that we have this information, now that these wonderful blood alcohol screens or urine drug screens are available, and we know, we've confirmed that these individuals do have mood-altering substances in their system at the time of this trauma, what do we do? For many years, there are many trauma surgeons who will say, we did nothing. We didn't even look for the alcohol. We didn't even look for the other drugs. And I think what we've seen in the research that's been published most recently is the number one thing that most people do around talking with young people about alcohol and other drugs is to do nothing, because the primary reason is we lack the confidence that we can have a meaningful and helpful conversation with that young person. The number one reason by far. Physicians, nursing, social work, as I've worked in the field for a number of years, and as I've looked at the research and our own research at Wake, definitely speaks to the primary reason we don't do more is because we lack confidence. So, everybody's ready to have more confidence after this 1 hour talk, right? I hope so. That would be my hope for you and wish for you. We definitely see that we have some work to do. Let me just share a little bit with you. Worldwide, what are we talking about in terms of youth? 31.5% of all deaths in 15 to 29-year-olds, men particularly, and yes, we see far more in the trauma setting, injured and or dying because of alcohol-related injuries. And you see worldwide that this is mirrored also. 86%, which is a rather high percentage, of these several million substance-related deaths worldwide, of these, again, 15 to 29-year-old men and women, are related to alcohol. Far more than any of the other illicit drugs combined. So you'll hear me point that out. In the US, how is it here? What can we look at here? What do we know? The CDC talks about 1 preventable death every 7 minutes because of excessive alcohol use. We're not talking about addiction. In fact, only 3 to 4% of all of those who use alcohol are really in that addicted range, which I know, I work in trauma. I know it can get skewed. It may look like everybody seems to be an alcoholic if they come in with alcohol on board, but it's not really true. A lot of people are risky users. A lot of people overdo it every now and then, like many of us, and they make choices that end up in injuries and hospitalization. And so that's what makes it a preventable death for many, every 7 minutes. I did want to show you, when I'm talking about a drink, as you'll hear, not that we'll have happy hour early, darn. I know, it reminds me of giving this talk about drinking and risky drinking to a group of bankers in their evening right after their cocktail hour. And I found myself feeling very isolated and alone. It was like, how did I get here and why did I say yes? I need more just say no. But when you see this, I want you to know when I say a standard drink, I mean one drink with liquor, which is 80 proof, 1.5 ounces. That's a standard drink. 1 5-ounce glass of wine. Many of you might think, oh, I'm getting ripped off at this restaurant. You know, I mean, it's like this big in the glass. Well, when one measures the standard pour for wine, it is 5 ounces. Those of us who drink wine at home may not measure so carefully, but you're invited to. I'll just let you know that. It's what we're talking about when we try to assess and find out what's going on with this person. And beer, rather than the double deuces, how many of you know what those are? Let me just I see some nods. Those, yes, when you do more of this work, you learn more than you ever thought you would about what's out there. And Four Loko, is that a popular one that people have heard of? Otherwise known as blackout in a can. It has about 4 standard drinks in one can. So when we're talking about standard, we really mean 12 ounces of beer. When I talk with some adults at times, they'll say, I only had 2. For some reason, 2 seems to be the acceptable number. You know, it's like I only had 2. And when I really dig deeper, that 2, you know, was like each one was this big. But it's important to try to look at what is going on. And also we know in the US, it's the 3rd major cause of death, excessive alcohol use. In these buttons on the side, you'll see 2 million other harmful events, like injuries, are caused by excessive alcohol use. $5.4 billion in medical cost. Does that ring a bell? $14.9 billion from loss of work and other resources. And the most important one of all, $41.6 billion in the lost quality of living due to excessive alcohol use. By far, for our youth, it is the #1 drug that is utilized. 1/3 of our children begin drinking alcohol by the what grade? 8th grade. Yes, that's about, know what ages are at 8th grade? 13, 14. I have a 9th grader daughter, so I'm much more aware of that, yes. And of those 33% that have had alcohol by that time, how many of them are reporting drinking to intoxication? Not just a sip or 2 or 3, but intoxication. Half of them. So when they're drinking, they're not just drinking a half or 1, they're drinking to intoxication. 7% of 12-year-olds, you say, 12-year-olds, come on, really? 12-year-olds, they're too young, aren't they? Drank alcohol in the previous year, 7%. How about 18-year-olds? What do you see? 70% of 18-year-olds drank alcohol in the past year. In 2009, just some more statistics for what we see in the United States. You see over 1,800 homicides, almost 1 million non-fatal violent crimes, such as rape, robbery, and assault, and nearly 2 million property crimes, all connected to underage drinking. When we look at the National Institute on Alcohol Abuse and Alcoholism, or NIAAA, as many of us refer to that, and some of their data from 2011, when they looked just to see ages and prevalence patterns, they looked at those 12-year-olds again, and these are what they found in terms of responses to having more than a sip or 2 of alcohol in the previous year. 1 in 15 12-year-olds, 1 in 4 14-year-olds. You can see the trend, can't you? And 2 in 3 18-year-olds. How much more it climbs so significantly as we go up. I want to share with you some of the work that was shown, and I don't know how many of you are familiar with this addiction series that was produced by HBO. But one of the trauma surgeons who's had the most impact in our world about what do we do, screening, after we get a positive blood alcohol or positive urine drug screen, what do we do, is Dr. Larry Dinalello. And HBO, in this 4-set DVD, went to Parkland Hospital on a Saturday night in the ER and just did a little filming. And I want to share this with you. I often, in working with people and presenting this, caution people that it's very graphic. But for some reason, I feel like at a pediatric trauma conference, I probably don't even need to give you that caution, do I? You've seen it. It's very much like what you see. But I think what I'd like for you to notice about what's going on here, and this is adults as well as youth, listen for the word counseling or counselor in this segment, and it's about 7-8 minutes. So I've got help here who's gonna cue it up, and we'll talk a little bit after we see this.
Here at the trauma center, it's Saturday night. These are where the problems really arise from too much drinking, too much drug use in our society. Put the ultrasound away. OG tube, let's go. We're here in the ER. I'm not flooded tonight with people who need their appendix taken out of their gallbladder. It's all drinking and injuries.
Have you ever had seizures from stopping drinking before?
I've had blackouts.
You've had blackouts?
This is probably our third incident this evening where we've had alcohol or drug use involved.
Go. What have you got there?
Stimulant at the crack here. They use that to smoke it. So
he's positive for benzodiazepines and opiates, but also positive for cocaine.
What happened to you?
This is 5 and 2 beyond street. Cut him across the head and cut him right.
I'm sorry.
I think it's pretty likely that drugs and alcohol were involved in this injury, both on the part of the patient and on the part of those who stabbed him. What happened to this patient?
42-year-old male in the parking lot, slipped between the curb and the wall, snapped his ankle.
Has he been drinking?
He's been drinking.
I had about a 6-pack.
A 6-pack, okay.
It's deformed.
I honestly don't think that this happened because I was drinking tonight. I think it's just because of the way I stepped.
Well, you may be right.
The way I stepped.
Normally, a patient like this would come to an emergency room. Everyone would focus on his ankle, and nothing would be done for the underlying drinking problem that caused this injury in the first place. Now's the time to offer him some counseling. He's an excellent candidate. We're going to keep an eye on him, give him his medical care, but by tomorrow morning, we're going to make sure he sees a counselor before he goes home.
how you doing there, sir?
Well, I'm doing all right now.
That sounds
20 right now. Barely turned 20. Happy birthday to me, huh?
But today you've been drinking?
I drank a little bit, yes, sir. I happy drink today.
What'd you drink?
I drink Jim Beam, sir. Today is my birthday. Right now is my birthday. Yeah, as of 12 o'clock tonight, it has been my birthday.
How old are you?
I'm 20 years of age.
20?
Yes, sir.
How many Jim Beams did you have?
I probably had about 15 to 20 shots.
We're going to fix that up for you, all right? But you're lucky you didn't damage any arteries or nerves that control the function of your arm. This could have been a lot worse.
Do you have any other history of drug use among people who are close to you?
Yes, they all use drugs. I wish they would. I quit. My best friend in the whole world. I love her so much. Baby, I wish you would quit. You know what I'm talking about? I ain't say nothing else. Please, baby. Please.
This is what we call a level 1 trauma. This is someone who's badly injured, who the paramedics have pretty much decided is at risk of losing life or a limb. So
Pupils are fixed and dilated.
the resources that we commit to trauma care are enormous. In fact, in some ways, it's one of the most expensive diseases that we face in modern society. And about half of it's related to alcohol use.
No, he's 26 years old.
We've got to give him every chance. The main thing is to stop the bleeding from his pelvic fracture. Let's shop him. Let's shop him. Go to 400.
Yes.
He's got a rapid pulse and a weak blood pressure, not much. I mean, his chances are slim to none, but as long as he's got a pulse and a faint blood pressure, we're going to keep doing all we can.
Yikes.
What's he got?
He's got it. All right. You found what you found. Let's move.
Is he bleeding from his back?
He's got a palatable back. His whole back's full of blood.
Well, how long have we been doing CPR?
We've been doing CPR for 19 minutes, and he was down 7 minutes when we got here.
Yeah.
We don't have anything.
All right, let's call it. Patient's expired. Did everything we could. Thanks a lot. You never get over seeing young people die. So we just checked this patient's urine toxicology screen. He was under the influence of marijuana. So he died because of intoxication. This is a young person. It's not like taking care of somebody who's 75 years old and died of a heart attack, or 80 years old and has cancer or dementia. It's a young person in the prime of his life, left his house today and expected to come home to his parents tonight, but he won't.
Thank you. And as you see, there's information there. If you have any interest or need to learn more about the whole picture of addiction, as I think very skillfully done by HBO, that is one of the ones that I would recommend. I think it's online available as well as the DVD set. Not that I'm trying to get you to purchase anything, but when you look at this, I think the words that he speaks so loudly and so clearly that are why we're here is how hard it is to watch a young person die in the prime of their life. And we don't get over that. We may do different things with that, and we may compartmentalize that, and we may shift that. But especially when we look at whether that's preventable or not. And one of the reasons that I think it's so important to talk about what we do when there is a positive blood alcohol level or positive urine drug screen is for what's depicted and representative of what you've seen, what you live with, what I see, what I've lived with. Because ignoring this has not worked. And so all of us are called into action to do something. So my answer that you'll hear me say over and over again about what do we do is we go further. We go further in different ways. I do want to highlight that when you look at level 1 trauma centers, Larry Gentilello's work led us to see that what I want to emphasize here, far more than the concentration in the emergency department of alcohol and other drug-related injuries that bring patients there. In trauma, 45 to 50% of all patients are there because of alcohol-related injuries, according to his Gentilello study and others that have supported that since, Shermer's, our own data when we look. Primarily, as you see in the trends, the 12-year-olds, the 14-year-olds, the 18-year-olds, yes, we see far more concentrations with 16, 17, 18-year-olds and beyond than we do in the 12-year-olds, gratefully. And yet still, because we start doing more after a positive blood alcohol screen or urine drug screen with exploring and talking individually with that 12-year-old or 13-year-old at the age of 12 in the trauma center at Wake. So 12 and above are going to get more. That's who we're right now focused on. Could we screen earlier? Certainly. But we're looking at 12 and beyond because there is a higher concentration. And what we've also learned that's been so compelling about this, which is why a person like me who's worked in addiction counseling for over 30 years found myself in a trauma center doing counseling at the bedside. You know, that's way out of any comfort zone or any familiar territory that I had ever been in. Why? Because when we go further, what we see is a 50% reduction in recidivism. 50% reduction. All my years of working in addiction and prevention and substance abuse counseling and addiction counseling, I've never seen numbers like that for reducing recidivism. It's impactful, primary prevention. So that's what we do. We go further. We don't just get information or data that someone has been using or that they've been drinking. We go further because this is happening to so many. I think Larry Gentilello, when I've talked with him, says, you know, I mean, what spurred him the most was just getting so tired of seeing people come back again and again and again and again. Wayne Meredith here at Wake chaired the committee on trauma that was so important in establishing this standard for the American College of Surgeons that in a level 1 trauma center, screening and brief intervention must take place for those with drinking problems. We don't get to know how or why. There's not a dictated way of doing this, but we go further. We go further. I want to highlight, along with what we've seen in terms of alcohol-related, by far, again, the #1 drug of abuse for our youth. When we look a little bit more, I've got a sort of a challenge for you. I'm going to ask you to just think of this. You don't have to say it out loud. You can make notes. But in the challenge for 12 years of age and above in the United States, here's your first question. How many do you think at least have been identified by our big research agency, SAMHSA, as having alcohol abuse or dependence in our country? 12 years and above. Just think about what percentage you think that might be. How many, next question, percentage do you think it might be that have risky kinds of drinking behaviors, overdoing it at times, not alcohol dependent, not alcoholic? And think about that number. And then here's the third and last one. I know, it's after lunch. We have to, just thinking. The percent in our country, 12 years of age and above, who are using illicit, illegal drugs. Think about that percentage. And, ready? Want to see some answers, some data around that? Because sometimes I think we have a skewed view. Because we don't know. Percent with alcohol abuse or dependence, about 7%. Percent of at-risk drinkers who could develop dependency if they keep going in the overdoing and risky drinking, 23%, nearly 1 in 4. And those using illicit drugs, 8%. Students that I teach in graduate level coursework in substance abuse counseling are often amazed by the data. They always argue with me, it's gotta be more for the illicit drugs, it's gotta be more for the illicit drug use. Surely it's more, although 1 in 12 is pretty substantial. But invariably, they tell me that it's a much worse problem than alcohol. So I at least wanted to share that with you to let you see and think which ones, if you have to choose what to screen for, what's the most important, or where do you start, or where do you begin? And alcohol is one of the ones that we see as a very important one to screen for if you're not screening for anything else. There are some resources that I'm going to make available, but I'm going to go over a little bit of highlights of what they entail. There is, and it's in your handout, there's a youth guide. If you're looking at going further, once you find out, yes, it may be a blood alcohol screen, I don't know. It may be alcohol in their breath. It may be what you heard from this 19 who just turned 20-year-old young man. Yeah, I had about 15, 20 shots. By the way, do you know what that's about the equivalent of? A fifth of liquor. And you may hear it from, I mean, depending on where they are and what they're willing to share, they may just tell you, you don't have to have a blood test. And you're in the ER or you're in the field. What I would say at that point is, what do you do next? What you also heard that surgeon emphasize is, after they are more stable, then they will get some counseling before they leave in the morning. The number one thing that we learn about screening and what do is, while a person's high is not the best time to have any kind of exploration with them. What was that? I'm feeling all right now. I didn't have anything to do with my drinking. It was the sidewalk that was the problem. So when a person has cleared the alcohol is the optimum. Now with marijuana, it stays in the system a very long time, so we're not going to wait until that clears the system. We'd be there for some who are daily smokers a month, and we know that's not going to work. So we'll do the best we can in terms of clarity with that individual when we talk with them. So going further also means being with that person. What I've seen over and over again is how challenging it can be at times to be with a young person, an adolescent, a 16-year-old who certainly has a positive blood alcohol level, was under the influence when they fell out of the tree, when they, what? You fill in the blank. What'd they do? Fell into the pool, ATV, and no helmet, of course. Don't need that, right, either. Has frontal lobe stuff. What? What else? What else do you see? Fire. Campfire, fell in the campfire, or built a fire, or, yes. Exploded stuff, The homemade meth that we sometimes see. What else? Youth, kids. Drove a car, crashed, yes, under the influence, absolutely. So, of course, you've got these positive findings, and you're going to go be with them. Really? Really? Again, where's that confidence level? Where's your confidence level? Yes, that's the most important thing we can do when we have a positive screen, is be with them about this. Do not pretend, do not act as if this did not happen. Now, that doesn't mean I come in and whop them upside the head and go, stop drinking, you're going to die. We've tried that. Many brilliant people have tried that. Many surgeons, physicians, stop doing that, you're going to die. Don't do that. And how effective is that? Nursing. We want so much for them to change. And yet, what we repeatedly discover, especially with youth, is that we cannot make them change. So first, as you are with that person, please keep that in mind. You cannot make them see. That is not your job, to make them see. You cannot do that. You do not have that power. What you can do is be with them. We spend a lot of work and time and effort and practice in our being with that young person, that 14-year-old. I'll share with you a story. One of the graduate level counseling interns that we have, of many, was observing me one day as I was asked to go see a young person who had a substantial amount of alcohol on board when they were injured. And it had been several days. They were stabilized. So we go into the room and I proceed with being with that person and begin to open that door and build trust and establish a caring relationship. And that involves skill. It's not just something that, you just automatically do. And we'll get to more of that. But as I'm there with this individual, It's hard going. I'm working hard. I am intentionally choosing and carefully, deliberately being very active about listening with this young person. And we did some work and exploring and talked about change, and he didn't kick me out of the room, and we got somewhere. Afterwards, this graduate counseling intern said, I cannot believe he even talked to you. He was so closed. He was so shut down. I just knew you weren't going to get anywhere with him. And you could say that about a lot of adolescents, some adults too. What we see is, with the work that we're doing though, we have a less than 2% refusal rate. You know, we walk in to see people who haven't called up and scheduled somebody to come talk to them about their drinking or other drug use. You know, it's not something normally people are like, oh, I'm so happy to see you. You brought news about my drinking and drug use? Blah. And yet we don't get kicked out, and we work with people. We have studies and data that show that what we do is effective, or I wouldn't be up here sharing this with you. What's most important in that being with that person is that you're not coming in with a shaming, judging, telling anything. I'm not there to tell. And what I see in the hospital and or healthcare environment is we're so task-oriented. Understandably, we have so much to do. And yet, when we are with that young person doing something with their positive alcohol and or other drug finding, it is about being with them first. All right, you're going, okay, what do you mean? I'm not going to teach you 2 years of counseling skills like we do in our graduate training program, but I am going to teach you one thing. That's a significant piece of how being with someone can work, especially a young person, okay? So let's pretend this young person, you know, is in the bed, I'll make it realistic, in our trauma center, and I come in and I say, I'm Laura, and I'm here because I'm concerned about your health. I'm part of the trauma team, and I'd like to talk with you. Okay. I don't start out with a question. I do not start out with a question. If you can do anything, if you can shift any of your skills, watch your questions when you are working with young people, if you're going to be with them about these positive screens or their drug use, other drug use. Hold those questions as long as you can. You may have them, it may be the nursing assessment, it may be some kind of triage assessment. Yes, I understand that. If you can take 1 minute though, even 1 minute, and develop that caring relationship in a non-questioning way, you're going to get further when you do bring out the questions. We know that. There's no question about that. No pun intended. So being with them, talk about being here. Talk about this. That's where I start. And then what do I do? So no questions, that's number one, being with. Secondly, what do? I reflect. One of the biggest skills in counseling, effective counseling, motivational interviewing, you name it, Rogerian, active listening, based in theory, is reflection. Reflection. You saw the surgeon do that briefly. Instead of arguing with the man about the sidewalk and the drinks, he reflected. You don't see that as something that happened. You don't see that as some kind of problem. You're not worried about your health. So I can go in with an adolescent who says, ain't nothing happening, I don't have anything going on, there's nothing to tell. And what do? I don't go, what do you mean there's nothing to tell? You're in a trauma center hospital and you've just come out of ICU or whatever. I don't do that. I go, it's hard for you to see that there's anything to talk about. Reflect. Reflect. I don't mimic their words, but I, in a very short amount of time, say something that holds up the mirror and reflects back to them where they are. So hold the questions and hold up the mirror. Reflect. You're not even sure why I'm in here talking with you. you're not sure what this is all about. You may be wondering where this information is going to go. You've got questions. Ask me. So that kind of reflection is a way to move with that person, being with them where they are at the moment without telling them, you got to change, you got to not drink, you got to not use. If I thought that was affected, I'd be up here teaching you that. You know, I mean, because everybody knows that one. It's not. It is not. It's shaming. It's going to probably bring up more resistance and more negative feelings towards you and the process than anything else you could do. Yes, you're concerned. Yes, you know, you're adamant that this needs to stop. But cognitively knowing that isn't going to be what's getting through to that other person. If you want to go further, as you're reflecting, you're building that relationship, you're establishing trust, you can then move into questions. So our next slide is going to be powerful questions that NIAAA researchers have developed. And this is very time efficient. I know time is of the essence. Getting here today from Charlotte through traffic was like, yes, I know time is of the essence. So 2 powerful questions that have been identified, only 2. Isn't that nice? I'm going to take away one question, I'll bet you, that routinely in your practice you use. I want you to just rip it up, free it from its papers or computer. The one thing not to ask, as you'll see, is do you drink? Do you use drugs? Take that out, eliminate that, free that. It is the most non-productive way to go about any question we can see when it's substance abuse that we're talking about. Take it out. You wouldn't believe how hard I've had to fight to try to take that question out. It's very interesting. Because most people, youth included especially, if we go straight in to this question that you see about friends drinking or about their own personal drinking frequency, what you'll see is that it's gently assuming the person does use or drink and that their friends might. Tell me about the friends that you hang out with and they're drinking. That's one of the questions. I change it into a statement as much as I can because it's still more productive. Tell me about the friends that you hang out with and they're drinking. They call it a side door way of getting into that person's world, respecting where they are, not going straight at them, and eliminating anything about do you drink. Because guess what? For the majority of youth who do not drink, what are they going to say? What are you going to say? If their friends don't drink and they're not hanging out with people who drink, what are they going to say? I don't have any. There's nobody around. I'm not hanging out with that crowd. That's a different group. Are they going to get all upset, distressed, and think you've just called them a, I don't know, teetotaler? No. Or a drinker. Or a partier. No. We find it's a much more productive way to go about it. And it's not just me saying that. This is based on national research that, believe me, has very carefully looked at what works with youth. Because sometimes youth are the hardest to work with and be with. The other question about personal drinking frequency, we'll get to that. But I want to emphasize, as you see here, any positive screens become manageable. So here's some samples around the brief screening and utilizing these questions. If you have to stay with questions, which you can, here's the first one. Do you have any friends who drank beer, wine, or any drink containing alcohol in the past year? So any drinking by friends is going to heighten my concern. I'm going to explore that further. I'm not going to just let that be. When we look at 9 to 11-year-olds especially, that becomes a high risk factor if they are around friends who are drinking any wine, beer, any drink. It's also a predictor of other high risk behavior that they are probably engaged in. It is the strongest predictor if they have friends who are drinking in the 9 to 11-year age range. Middle school, ages 11 to 14, again, asking about these friends is the first place you go with these questions. And I do it in the tell me about your friends who drink wine, beer, or other alcohol that you hang out with. Tell me about them. High school, it switches. For the 14 to 18 age group, we go straight in about the frequency. How about you? Have you ever had more than a few sips of beer, wine, or any drink containing alcohol? That is also closely matched with on how many days in the past year did you drink. You want to know that in terms of your work with that patient. 1 to 5 days, 6 to 11 days, 12 to 23 days, 24 to 51 days, or over 52 days. And there are some risk profile categories that help us when we look at the frequency. I want to at least highlight this example. A 15-year-old who reports drinking about twice a month or 24 days in the past year is at highest risk for adverse consequences. And I'll show you a guide. If you can pull that up on the PDF, I have help back there. And this is a document that the NIAAA developed. It's available for anybody who's working in this field. Did it go away? Is it open? Thank you. I'm used to doing this myself, so it's great to have help. You can download it for free. You can order hard copies. It has a pocket guide. It is specifically designed for medical professionals. If we can go to page 7 on there in the document. So the pocket guide can fit in any pocket, and I just want to give you an idea of the ease of use and the step-by-step information that it gives you. It helps highlight. You can hold it right there, and if you can make that larger, that would be great. Okay, so as you see at a glance, there are 4 total steps that they're asking you as a professional to involve yourself with. I would add the 5th, which is be with the person first. Be with them, develop that trust, that care by reflections. If you're finding from the 2 screening questions that there is drinking going on, then you start assessing the risk. Is this low risk, moderate risk, or high risk? That helps me know what more I want to do. And then in the step 3, there's advising and assisting. Again, for lower risk, brief advice to stop drinking. Now, how you say that to a child, a 12-year-old, let's say, who's been drinking, again, lowest risk, maybe twice in the past year, and you're saying, I want you to stop that. I'm concerned about your health, has been shown to have an effect. Scaring them often will get a short-term result, but it will not help in the long term. Moderate risk, provide brief advice, or if problems are present, conduct brief motivational interviewing. You can learn more about brief motivational interviewing. There are lots of workshops that will help that, but the core of motivational interviewing is reflect. Reflect, reflect. I also connect it to health concerns. I'm concerned about your health. Drinking anything at 13 can affect your body in ways that would be hard for you to see. Help me understand the pros of keeping doing that. This is a technique in motivational interviewing, pros and cons. Tell me about why you should keep doing that. How do you see that as healthy? How do you see that as something that benefits you? Because that can lead to a very rich discussion about how to get those needs met in other ways. Like I'm tough, or I'm cool, or I'm part of the crowd. So you can keep doing it that way, and you can think about other ways that you might want to be cool, be part of the crowd, and also help your health. And most youth are willing to go there. Not all. I'm not going to say, oh, it's a breeze. It's not. But most youth are willing, and health, I have found, is a neutral area to talk about. It's not stigmatized. There's no shaming in that. Everybody can get on board with that. So that's a powerful way of working with that person. And then following up with them if there's moderate risk established. At the highest risk, it is definitely conducting, they say brief motivational interviewing, and referral to treatment consideration, and follow-up. I really want to ask each and every one of you who works in the healthcare, when you have someone who may be exhibiting symptoms of, I don't know, a cancerous growth on their hand, let's say, that's painful, and they show it to you, and you say, well, you know, what have you been doing with that? That looks scary, or that looks alarming, or, you know, what's going on there? And they say, oh, I've just been putting Neosporin and a Band-Aid on it. Are you gonna go, oh, okay, carry on, sure, fine. No, what are you gonna do? You're gonna urge them to make an appointment with a specialist of skin, I don't know, cancer, something, whatever you're assessing that to possibly be, aren't you? Why wouldn't we do that when we have highest risk, which would be a 9-year-old who's got friends who are drinking and is taking more than a few sips, even twice a year? We would, that's red flag. Send them to a specialist. Specialist in your areas. Urge them to go, because they need to get that evaluated. They need to get that checked out by a specialist. It's not something that's just going to go away on its own. When you, if you'll go to the next page, again, this will be clear as you look at this. There are 2 screening questions divided up by age. And again, you can see, starting off with the younger ones, elementary and middle school, talking about their friends who drink. Now here's what's not written in this book. You'll get, if I started asking you about your friends and their drinking, and you were 12, how do you think you'd respond? Or what would maybe be crossing your mind? Aha, see? You got there right immediately. And they didn't even have that in the book. I'm like, where did we? Yeah. So what do I think is very important when you're with them? You want to be clear. I don't want to know names. I'm not trying to get anybody in trouble. I'm not looking for that. I'm just trying to help understand your world. So just the friends you hang out, just the friends you spend the most time with, the BFFs, talk about their drinking. They're getting high. They're partying. Help me understand that. Big difference than just going straight into the friends. Preface it with, I am not here to find out names. I don't want to know names. I am not here to try to get anybody in trouble. I'm trying to help you, and I'm trying to understand what's going on. That makes sense? Yes, I hope. It helps build trust. And then in high school again, so we change it to drinking frequency, more than a few sips of beer, wine, or any alcohol, and how they respond to that. And if your friends drink, it changes for high school. If they drink, how many drinks do they usually drink on any occasion? If it's any binge drinking, that heightens the concerns. So I want to go back to our PowerPoint and let you know this is, again, downloadable. You can easily access this. I didn't want to cut down a lot of trees and make copies of this. So I selectively pulled some from it. And most people say that it's a very helpful guide, at least, to get the conversation started. So although youth drink less often, less frequently, when they do drink, guess what? They drink more. They don't drink a half a can of beer. They don't sip. Youth drink over 90% of their alcohol by binge drinking. Just some stats, 6.9 million young people had 5 or more drinks on the same occasion within a few hours at least once in the past month, according to this Monitoring the Future national survey. 2.1 million young people had 5 or more drinks on the same occasion on 5 or more days over the past month. So you can see that when drinking happens, it's to excess, which is the other alarming factor for pediatric trauma, which is why we see them on the ATVs without the helmets. We see them falling out of the tree. We see them, you know, drinking before they get on the bus to go to school, and not just drinking a little bit. More teens use alcohol than smoke cigarettes or pot. There's also significant connections with risky drinking and violence. The prime factors in 3 leading causes of death for U.S. youth from the age of 12 to 20 right now. Suicidal ideation, intimate partner violence, and we see this in high school. I was just talking to a school counselor who was saying so much more intimate partner violence, boyfriend, girlfriend, especially with drinking and partying going on, than she's ever seen before. 97,000 college students, according to Hingson's research, who's very helpful in our field, were victims of alcohol-related sexual assault or date rape in a year. So I want to say and emphasize talking with, being with, doing more, going further when there is a positive urine drug screen or a positive blood alcohol reduces trauma recidivism. And if nothing else, that would, I believe, get your attention. How can we help this not happen again? People who participate in a brief counseling intervention change their drinking patterns after discharge, sometimes substantially. In our study that we looked at severe risk drinkers, these were adults, they, at 6-month follow-up, 70% of them had made substantial changes in going from severe risk to either no risk or lowest risk. Alcohol screening and brief interventions also cut cost, healthcare. So this youth guide, I hope, will be of value to you and something that you can find, easily get, use, ask questions about. Email me, try to let me know if I can help in some way. And then I'm going to leave you with this. What about the future? Okay, who can identify every single thing on there? New trends. What are they? Synthetics. Do you see, what's the one with the angel wings? Bath salts. Anybody ever heard of bath salts? Everybody? And they're not something you use in your bathtub at all. And the youth I've worked with here have had substantial issues with bath salts. The ones that have gotten to the hospital, and I see it's highly addictive, is the bad news. And has a very seductive euphoria related to it, so young people are very eager to use it. What's the pills with the sky on it? MDMA, otherwise known as, who just made that famous with Madonna and Molly, yes. And you'll love that one in the top, decimorphine, produced in the 1930s, synthetically. Anybody know what that is now? It's making the headlines in many places. Crocodile. Have you heard that one? Crocodile? It's gotten that name because apparently it's necrotizing in that it turns the skin green and has great complications, opiate synthetic drug. And then this last one I'm saving, how many of you know this one? Or maybe you shouldn't raise your hands if you know this one, because then I will probably want to talk with you afterwards. Vaporatini, you know that one? And what are people doing with Vaporatini? What is that? You know the fastest way to get any mood-altering substance to your brain? Smoking, inhaling. Vaporatini vaporizes what? Alcohol. Alcohol. Yes, and from their website, for $160, you can have their artist series apparatus. Alcohol is inhaled rather than swallowed. This is from their website. It's absorbed directly into the bloodstream. This is their marketing. And does not go through the digestive tract. You know why a lot of young people are interested in it? Exactly. No calories, no carbs, no impurities, and the effects of consuming alcohol are immediately felt, making it easier to, this is their words. And guess what? It's legal in where? All states. But just be aware, it will be detectable by a blood alcohol test. Yes, so we have new trends, being with that young person, opening the door, creating a safe environment where you will listen and not lecture is what we can do as we go further with working with young people. I appreciate your time And any questions you may have or contact information I provided. Yes, sir.
Where are the 12-year-olds getting the alcohol?
Ah, great question. Where are the 12-year-olds getting their alcohol? The number one source for not just alcohol for youth, but pills, medication, are parents. Number one. Absolutely. No question. Not friends, not peers, parents. And there's, as you know, a serious trend with using, there are punch bowls parties where kids will just bring their different drugs they find in their parents' medicine cabinet, throw it all into one big bowl, and have at it. And they don't even know what they're using, but it's supposed to be fun, so we'll do it. Good question. Yes? Right. Very important, yes. Non-detectable Molly, the synthetics, our screens are not picking them up unless, I mean, there may be some that can be purchased that are extravagantly high in terms of, they're buying it online, they're buying it from friends, they're buying it at stores. So what we wanted to try to do there, instead of what are you using, at least turn it into a statement as much as you can. Tell me all the things you've been using right now. Talk to me. Tell me. I need to know. Instead of what are you using, what did you use today, when did you drink, it's like being bombarded. So it does nothing but erode the trust. And yes, I understand how we can get locked into that. When we look at how effective it is, we can see there are other ways to get that effective information. Tell me, tell me. It's a great way to be reflective and be with them instead of bombarding them. But yes, you will not see the screening for the synthetics, especially the bath salts. It doesn't exist. We can't rely on that. And a lot of people will deny that they're using it. So when they're hallucinating and doing very bizarre things and don't respond to being tased or secluded or held all in the normal way they would, you want to start suspecting that this is some kind of synthetic drug. Thank you. Yes?
How do you use the bath salt and the crocodile?
How do you?
I don't, it's like, way over. Google it, Google it.
Google it and you'll find out. You'll learn more than you ever wanted to. Inhaling is a big way. Digesting it, putting it in cigarettes, any way you can think of to use it, it will be used. So it's various ways. And a lot of kids that I work with, and adults too, they don't care so much that you know how it's used. They want to know if you can help me live differently. Can I make changes? That's where you have expertise in, you know. Can you help me learn how to be cool without this stuff? And that's what you have. One more, yes. How about that? These parents? No, absolutely. Maxon did a study in Texas with caregivers' parents, screening and brief intervention. And we proposed to do that here. And it hasn't yet been awarded. I don't know why they wouldn't want to fund that. But very much, parents and caregivers can be using to a great degree. Absolutely. It is not, I had this conversation with students today. Culturally, it is the norm for many parents, not all, certainly not all, to be drinking and using, and I'd rather you stay home and drink. I'd rather you smoke pot here. You're not out driving. Harm reduction is the thinking there, and yet we know that is not healthy. So I try very hard to spend time alone with that young person. And my license as a counselor says I can have privileged information. Medical professionals are much more at risk for knowing you had a positive alcohol level, you had a One of our highest levels was a young girl who was like 15, and she had like 460 blood alcohol level, tiny. And you know, if you're a medical professional, you would want to convey that information that your child is at high risk for poisoning, future use, all of those things. As a counselor, licensed, I can say, this is privileged information I can't share. And so with the parent, what I will do is say, I need to spend time alone. I'm here to help. I will work hard to try to talk with you all together as I finish up so we can go over where we can go from here. And I work very hard with that young person to agree to bringing their caregivers into next steps. What do we do from here? They don't all agree with it. So that leads to consternation and difficulty. But most parents, except for college students, I found, most parents will leave the room. They will let me be there alone. In fact, most are urging, please talk, please talk. I'm so scared, I'm worried. College students, I found it interesting. It's anecdotal, but they're like hovering and will not let go. You know, no, I'm not leaving, I need to be here. I'm like, that might not be as helpful as if we could spend some time alone and then I'll meet with you. But yes, just like I've been taught, whenever you have someone who needs tests, you know, to come in and say, you know, well, we need to conduct some tests now, we're going to pull the screen. Doesn't everybody like leave the room? Do you have many people clinging and hanging on? Not usually. So we approach that the same way. This is important and we need to do this separately. Normalize it. It's like another test. Anything else? Which one? Oh, I lied. I said that was the last. This will be last.
See the last slide where you gave me the NIAA website.
Okay. If you don't mind, or do I want to? Can I go backwards? Up. It's not.
Hold on.
He's got it. It'll be there. And their handouts, so I'll make sure that there's those more floating around and some other information from the youth guide. Thank you so much, and I'm glad you're here.